Hello, Dallas. It's time to wake up and get wealthy. I'm Terri Arends, Group Fitness and Wellness Director with the Aaron Family JCC, and we are here to get a little smarter when it comes to heart-healthy life tips and heart-healthy lifestyles. So I have two amazing guests on our show today. We have Dr. Aggarwal and also one of our members, Karen Reisman, who is going to share her story on heart healthiness. All right, so I would like to thank both of you guys for coming on the set today. So thank you. And I'm sure viewers by this point know that Dr. A, I'm going to call him Dr. A, he is just a repeat guest, and so we're really always honored to have you every time that you come to share your knowledge and medical opinions and so forth. So I just wanted to start out with just a little bit on, last month was Heart Healthy Month. It was, February, and it's all about heart month. And so I was just kind of curious if you could tell our viewers, what are some things, Dr. A, as far as recommendations for us sitting here, our viewers out there, just in developing a strong and healthy heart? I know some of those are going to be fitness related, so bring it on, but also from the nutrition end, and maybe if you were like to give like maybe 5 tips, what would those be?
Yeah, absolutely. Well, I think it's broken down into 2 categories. So the first category would be things that you can do at home. The second category would be things that you do with your doctor in the doctor's office. So things that you do at home are, having a balanced and sustainable diet. It's very easy to Google a diet and do it for a couple of weeks, look really great, and then really go backwards for the following couple of weeks. So having a kind of a balanced diet, a healthy amount of carbs, proteins, and fats. The second thing is thinking about what kind of alcohol use you consume. I myself enjoy a glass here and there, but being mindful of how much you drink and how frequently you drink plays a big role in heart health. And then the third piece at home that you should be more mindful of is your tobacco use. And tobacco, it's kind of a zero tolerance. No cigarette is enough. Let me be more clear. A single cigarette is too much. And so, quitting tobacco, if you do consume tobacco, would be really important. Now, from your relationship with your doctor, things that I think about with heart disease are 3 basic ones, which, the take-home point here that I want you to think about when you are at your next doctor's office visit is, do I have high blood pressure? Do I have high cholesterol? And or do I have diabetes? And those 3 things oftentimes go unchecked until somebody develops some significant heart attack or heart event. Oftentimes, if we can catch it, we can treat it, and we can make it insignificant. But unfortunately, there's times that we catch it way, way, way too late.
Okay, so tell us then, those 3 things that you just mentioned, how would I know, maybe I'm sitting here right now, maybe I'm at risk, how would I know, or how would our viewers know? What are some of the signs?
Yeah,
without even getting tested, possibly.
Yeah, that's a good question. So unfortunately, there's not really great signs. And that's why coming to a doctor like myself or your primary care doc, internal medicine, family medicine, cardiologist, whomever, going to your doctor and having these conversations is really critical, because unless you've got really, really high blood pressure, you're not going to have symptoms. If you were to have symptoms, it could include bad headaches or bad changes in your vision, maybe some chest pain. There's literally no symptoms of high cholesterol, so you just have no idea. And then with diabetes, you can have early stage diabetes and have no symptoms either. If you've got late stage diabetes, inevitably you'll probably develop some symptoms. You might be fatigued, you might be urinating a lot, you might be very thirsty. So if anybody listening thinks that that's them, you really ought to make that phone call today and say, hey doc, something's not right. I don't feel like my usual self.
Okay, so I'm kind of curious, I'm going to throw this one out there. Maybe you don't have any of those particular symptoms, but what if you started like a new activity and from time to time you're feeling a lot of like cramping, even from your toes to your hands? Are those symptoms that also could relate to heart disease?
They could. Heart disease is tricky because men and women present differently. So classically, males, myself included, are the ones that are going to say, my gosh, I've got very significant left-sided chest pain, or they're out of breath, like they pick up a new exercise routine and they just can't do it, they're huffing and puffing. women, as we may hear about your story shortly, women present very differently. Sometimes women present just with fatigue, or they present with nausea. They present just saying, "Doc, something's not right. I know my body well, and I just don't feel like my usual self." And so I take symptoms really seriously across the board. One tidbit that I want to share with the listeners is that heart disease kills more Americans than any other condition that we know of, by a large amount. So, when we think about Cancer Month and this month and the next month, those are all important things. I treat them, I prevent them, I do my best to manage them. But heart disease, unfortunately, takes over in such a major way for both men and women. And so any symptom is enough for me to say, could this be her heart or his heart talking?
And I have one more question to ask, only because this is on the fitness end. As far as cardiovascular activity, does that, like if you were going to rank those, is cardiovascular activity play more of a role of prevention versus strength training? Or is it a combination of the two? Is there a magic bullet?
Yeah, that's a good question. So it is actually both. And the reason for that is, when we think about cardiovascular training, I think about swimming, running, and being on a bike, elliptical, those kind of things. The heart is a muscle. So if I want to get a six-pack or I want to get stronger biceps, I've got to work my abdominal muscles or I've got to work my biceps. So similarly, the heart is no different. And so doing cardio is really critical. But strength training in the form of weights is also important, especially as we get older, because it's in our natural, and all of us will lose muscle mass as we get older. And so the guidelines, which can be a little bit aggressive, but the guidelines suggest that you should exercise 150 minutes a week, which is generally broken down into 5 30-minute segments for cardio.
Right.
And then you should do 2 episodes or 2 instances of weightlifting a week. And if you can really commit yourself to that, that is plenty for your heart health.
Do you hear that, Jay members? It's just a few times a week. Go to the spin classes, go to the boot camp, go to the HIIT, and come to my strength classes. That will give you that really well-rounded, options for prevention. And speaking of strength classes, Karen Reisman was in one of my classes, and she walked up to me, I think it was before class started, and said, "Hey, I'm just returning from, I had what was it, a couple months ago, a heart attack," and she was rehabbing. And it took me back for a minute.
It took you back because
look at you.
You've seen me here for years and years doing exactly what Dr. A has said to do. I do work out and I do eat a balanced diet and I do lots of things right. So what I'd like to share is just summary of what happened and how that can benefit you, our listeners. So what happened is that it really does go perfectly with what you just said. I wake up on a Wednesday morning, put a pin on Wednesday morning, and I don't feel, it's like identical what you said, I don't feel quite right. And I had several symptoms. My heart was racing, I had a tiny bit of pain going down both arms, and I was nauseous. I thought, I'm really healthy. This is weird, but I'm gonna be fine. So 2 of those went away. It was very fleeting. And so I got up and I still felt nauseous, which is not normal for me. And I did my whole day. Can you believe this? I came up here and I worked out with my workout buddy. Then I met my walking buddy and I walked 6 miles. I'm not exaggerating. I walked 6 miles. I did a ton of errands. It was a very windy day. And then I had a client. I run a communication consulting business, so I had a client, went to dinner. I had something to do that night. Still didn't feel all that great, but I did a whole day. And then the next day I wake up, now we're on Thursday, I had another equally crazy busy day. And then I guess you might call this a big fat denial. Something's really not right, and I'm not doing my job of listening to myself.
Did you still have the only
No, just sluggish.
Okay.
Just sluggish, not even that nauseous, sluggish, but nothing else.
Okay.
My husband and I have a place, we live here in Dallas, we have a place about 100 miles away. We even went there. So now I'm 100 miles away in the middle of nowhere. We have dinner, And I am also a speaker, so I have no problems talking. And it was after dinner, and my husband looked at me and he says, you look really serious right now. And I go, so the fourth symptom that happened, the other two came back, not at a 3. So this was, like you just said, this was not a Hollywood heart attack. This was so subtle. But those other symptoms came back, the pain in each arm, the heart, I could feel it, and then the nausea was worse. And then here came the fourth symptom that was really huge for me. You ready?
Yes.
I stopped talking, which is a lot for me. And he goes, honey, we need to go to the emergency room. And then I'm still arguing with him. I'm arguing.
Of course you
And
are.
I'm arguing because, no, I'm going to be fine.
Yes.
But it finally, he insisted, and I'm so incredibly grateful. And we went to a hospital. Remember, we're not here. So we went to a small regional hospital. They were fantastic. They confirmed, and I can't even believe I'm going to say this sentence, they confirmed that I had a heart attack. I almost had a heart attack when they told me I had a heart attack. I mean, I was still shocked. I was so shocked. So I was there overnight and came to Dallas the next day and had a procedure. So I just want to talk about how this can benefit you. First of all, please listen to your body and don't be in denial. Listen to your body and listen to your trusted doctors. Secondly, as Dr. A was saying, if you walk into something like this healthy, then you're really much better off than if you don't. In that 2-day period that was quite traumatic, there was two questions I kept getting asked because I switched hospital systems. The 2 questions were, do you smoke cigarettes? And the answer to that is no, I have never smoked a cigarette in my life. Here's the second one. Do you have any heart disease in your family? And I have to mumble and say, yes, my mother died of heart disease in her early 70s. And so in that study of me, you can glean a couple things. One is sometimes it is a matter of stuff we can do, and there's things that we can't do. So genes and DNA play into this. So even more so, stay in good health, stay in good shape, because the outcome for me, I'm so grateful. I did not end up with heart damage. I had a procedure, I had stents put in, but I did not have sustained heart damage, and I'm just very grateful about that.
Well, we're grateful that your husband insisted that you go to the next step, and so that's really, I can see that whole conversation, I can see that happening with me personally.
Yeah.
Like, because I always feel like I'm invincible, and I always thought, oh, that ache or pain, that's nothing.
I didn't have time for this,
Yeah,
Terry.
and that's how I feel. I
didn't
never
have
have time.
time.
I don't even get sick, so I get it. And I could hear probably my husband in the background saying, let's go, let's get this checked out. And I'd be like, wait till another day.
No,
or so.
it'll subside. These symptoms will subside. So Dr. A, you were spot on in what you said. It was subtle.
Totally. Yeah, what I've learned in practicing for all these years is that what I bring to the table in a doctor-patient visit is the science and the experience, but what you bring is your story, right?
Yes.
Like, you have to tell me, hey, this is normal. Like, I'm nauseated every couple of weeks. I might have eaten something bad. Okay, great. No, I'm not so worried about it. But if you say, this is not who I am, I'm usually not nauseated, I have to take that seriously, right? And so I think working together, that's why it's really critical that you've got a doc that you really trust and that you build a good relationship with.
Yeah, that sounds so key to have that relationship with your physician. So that's something I think for all of our viewers to really start building those relationships with your physicians.
I mean, I would like to add that I'm not stupid, but this was this. I can't believe it happened because I do stay in good health.
Yes.
Terry was so surprised that day when I told her because she's seen me up here for years.
Yes.
But I would argue because you were so healthy going into that event is why you're so healthy right now. Is that if you went into that event with some uncontrolled risk factors, if you went into that event with a little bit of tobacco use, if you went into that event without working out very often, it might not have been just a stunt or two, right? It might have been you've got congestive heart failure now. It might have been you're a candidate for open heart surgery, you're et cetera, et cetera. And so, it's really critical to be as healthy as you can be going into one of these major events.
So that's being proactive, but I also want to share that after an event like this, you can do cardio rehab, and I would love to share with our listeners that no matter where you are on the continuum of healthy habits, you can pick those up after the event as well. And so I did some cardio rehab, and I came back here, and it was when I was in your class, I said, maybe she should know.
That's a good idea.
It's always helpful.
These things can happen, but to do something after the fact is wouldn't you say, Dr.
Yeah,
A? I mean,
absolutely.
It's hugely critical.
So it turns out that on my side as a primary care doc, when my patient like you has a heart attack and you go to cardiac rehab, I have to authorize that. And I have to make it clear to you as the instructor to say, this patient just had a heart attack. Yes, cardiac rehab is important, but the point is not to set a personal record. The point is sustained activity, not go hard, because the heart is not perfect right now, right? It's really good, but it's still not perfect.
I was surprised at how tired I was, and I will tell you that the rehab program, you get that monitor and you put it on you, and so it rebuilt my confidence level back. That I wasn't going to keel over and I did this normal stuff.
Right.
And there are lots of people in there that, as you would say, were a variety of ages. Some people walked in there, they were young, they looked like they were you. They ran boot camps, and others didn't. There was the other side of that coin as well. But there's a real potpourri of individuals who had handled some kind of heart situation.
So speaking about all those different individuals with different types of fitness levels, and some that are real regular with working out and some that aren't, is there a difference? Is there different signs for somebody that is of an older population versus like our population, like to go medium of the three of us right here in our age?
Unfortunately not, no. And we don't know why women and men present differently. And as far as the data that I reviewed, we don't think that there is consistency in this population of age presents like this versus this does like this. I think the biggest thing is what you had mentioned previously, which is that denial piece of like, I'm gonna be okay. This is really not that big of a deal. And that denial is very real. And admittedly, males have that gene more than females do, because we're like, no, it'll be fine. It's really no big deal. So it's interesting that you felt that way too, because that's kind of refreshing for all of us men out there. But it's really just trusting your body and saying, listen, I've got that long day. I've got a lot of things coming up, but it doesn't really matter if I have a heart attack, right? Like I've got to get the care that I need to get. And so, as a small plug for myself, the reason that I love to practice the way that I do now is that relationship is there with patients. So they can call me or text me on a whim and say, hey, I don't feel right. What do you think about this? Or hey, something's just not right. I'd like to come in and see you today. And that simple visit, as you come in to see me that first day, I would have diagnosed you that same morning on Wednesday morning and gotten you into whichever system that you wanted to get into and gotten stents then. And it really would have been catastrophic if you were 100 miles out and then, had a drop dead of a heart attack.
God forbid. Right? So, I feel so blessed and,
Amazing. I feel so that thank you for sharing your story.
Yeah, I really can't believe it. I almost didn't, because I don't talk about this. This is, I speak on other subjects. Yes. I speak on this.
And I remember you telling me that, and then I was like, no, come on, you got to share your story.
Yeah, it was humbling, I would say.
Yeah.
Quite humbling.
Yeah. So, Dr. A, what would you prescribe for or suggest as far as, okay, so we got the physicality, the weight training, the cardio, but always nutrition is a factor in anything we do. So if you were gonna say like your top 5 or 3 foods that are really good for assisting in heart prevention, what kind of foods would you suggest?
So that's a tough question to answer. I'd answer it in this way. So if you were to Google a diet on Google, what I would write is a Mediterranean diet. That's the one that is consistently the heart healthiest. It's been proven in the literature time and time again. And the Mediterranean diet is mostly seafood, veggies, fruits, nuts, olive oils, some healthier cheeses. And that's a really healthy option. I would be really wary to start a diet like a keto diet because it's hard to sustain. You know, I've got patients for years now that have done it to have that crash course for a pre-wedding or a pre-this, and it works really well because naturally if you starve yourself of carbohydrates, your body is forced to burn fats, and I totally understand the science behind it, but the sustainability is a little bit more difficult. The one diet that I would mention that I think is actually helpful, and I'd like to call it kind of a lifestyle. A diet is, it sort of gives a negative connotation, but a healthy lifestyle option is something called intermittent fasting. And intermittent fasting, for the listeners that are not aware of that, is you basically pick an 8-hour window that eating is totally appropriate. Not to say that you should eat all across all 8 hours, but eating is appropriate during those 8 hours. Again, balanced meals, having your fruits, your veggies, your proteins, your carbs and fats. But I recommend that to patients all the time. And so what I generally say is, have a little bit of a late breakfast around 10 and have your last meal at 6 o'clock. And if you can really sustain that, the body does really remarkable things between 6 p.m. and the following morning to burn excess fat off. And so when you ask me what are some heart-healthy foods, I'm reluctant to give an answer simply because there isn't a particular one. I mean, if you have most things in moderation, you'll be okay. But I do want people to walk away with the idea of a Mediterranean diet and the idea of intermittent fasting, both scientifically proven, both to be quite helpful.
Okay, great. Well, do you guys have anything else to share? I will say that I think one of the biggest takeaways today is just for our viewers to walk away with that heart disease is something that it does not discriminate. And so it's really key that, everybody takes some of the bullet points from today's segment and really takes it to heart. Do you guys have anything else to contribute or?
Well, with my study of one here, that some of this is we can do and help and affect, and some of it is genetics. But because of that, it's even more important to take care of yourself and try to do the things that Dr. A has talked about. And I'm very, very grateful to be here and share this story. And I hope my story can make you, if you're not feeling right, don't wait, from Wednesday morning to Thursday evening. Don't do that. Learn from my mistakes.
Yeah, I think that is another huge suggestion because, for some of us that, if you are a little athletic and you are kind of working out a lot and eating right, think you eat right, and to just be in denial of not listening to your body, I think that is something that it's kind of hard for people like myself that are cut from that particular cloth to not, it's just a little ache, it'll go away, and not really seriously listen to your body. So I think that's another really important message to resonate. Dr. A?
What I would leave everybody with is think about the last time you went to your doctor's office and make sure your next doctor's visit is talking about heart health and what can you do to prevent heart health, what can you do to screen heart health. There's a lot of imaging modalities that we use regularly that could have detected Karen's condition 6 months ago. And it's just a matter of asking the right question and saying, hey, I was on a podcast recently and I heard somebody named Karen have heart disease very unexpectedly. I don't want to end up like that, although she had a good outcome. What can I do? And the answer from the physician standpoint is, let's obtain a calcium score. Let's obtain a CT scan of your heart to look at your heart arteries. There's things that we can do to be very proactive, but it's a matter of showing up to your doctor's office.
Okay. All right. Viewers, Dallas, until next time, remember, wake up and get wealthy. I'm Terri Arends. We'll see you next time. Bye-bye.